Viva. Good morning. Welcome to the press briefing of the Information Service in Geneva. Today is Tuesday, 12th of April. We will start immediately with Ukraine, with the spokesperson and media relations officer of the WHO, who is calling in from Lviv, and then we will put the spotlight on the situation of food security in Somalia and South Sudan. There are a number of colleagues that are available to answer your questions online, although they are now briefing proactively. So don't hesitate to ask a question, for example, now that we start on Ukraine, also to Matt Salmarsh, Paul Dillon, and other colleagues that you have on your list. So I'd like to now go to Lviv to welcome Banu Batnagar, and ask him to start with his introductory remarks, and then we will open the floor to questions. Banu, you have the floor. Thank you.
Thank you very much, and good morning from Lviv. So a few updates for you today. WHO continues to bring supplies into Ukraine and distribute them across the country from our warehouse over here. We have so far delivered 216 metric tons of emergency and medical supplies and equipment to Ukraine. And of that, 122 metric tons, is just over half, have reached their intended destinations. And that's mostly in the east and north of the country where the need is greatest. Now, we're doing everything possible to reopen our operations and country office in Kyiv. It's really important for us to be in the capital city, where we can assess the health needs of the populations in the surrounding areas, conduct our daily operations, and interact with the key government stakeholders. It's also important to ensure that we are delivering the right assistance to the right places and at the right time, in close consultation with the Ministry of Health and many of our partners who are based there. We're also interested to expand our operational base in Dnipro, in East Central Ukraine, and that's also to be closer to the people who are in the greatest need of life-saving assistance. Operating out of Dnipro, which is a strategic hub, still remains uncertain, but this location will allow us to mobilize resources more quickly and reach some of the most vulnerable people with urgent supplies. And we will do our best with other UN agencies and partners to work out of this region to respond to the crisis. Over the coming days, WHO will be providing 15 generators to hospitals across Ukraine that have limited or no power supply. The generators are destined for oblasts in the east, in the south, and in the north. And we have set aside 2 generators for hospitals in Mariupol for delivery as soon as we can get in. We are importing 20 ambulances to Ukraine this week, 2 of which have already been delivered, and we will be handing them over to the Ministry of Health, who will then decide where to send those ambulances. We're helping the Ministry of Health through our emergency medical teams to set up field hospitals where health infrastructure has been damaged or destroyed. And we're delivering a concept paper on that to provide guidance on how best to do this in a conflict setting. And we're also working with the international and national partners to establish mobile health clinics that can provide basic primary health care. And we're particularly working on where exactly these mobile clinics will operate. Roughly 300 health facilities are in conflict areas at this time, and about 1,000 health facilities are in changed areas of control. And that leaves the health system really vulnerable to infrastructural damage and severe disruptions to critical services. And this means there is limited or no access to medicines and health facilities and health workers in some areas. We're supporting the transfer of patients as well, requiring medical evacuation to the Polish border town of Korszowa, where the Polish government has set up a health facility for up to 200 patients with the help of the European Commission. Our emergency medical teams, in consultation with the Ministry of Health here, are assessing who is eligible for evacuation. And this can include children and adults with cancer, patients with conflict-related injuries, and other patients who are just unable to be treated in Ukraine at this time. And this is to reduce pressure on the Ukrainian health system. As of yesterday, WHO has verified 108 incidents of attacks on healthcare in Ukraine. This can range from attacks on health facilities and personnel, transport like ambulances, supplies, and warehouses. At least 73 people have been killed and 51 people injured in those attacks. And we continue to condemn in the strongest possible terms all attacks on healthcare, which not only deprive people of vital health services, but are also a violation of international humanitarian law. I'll leave it there. Thank you very much.
Thank you very much, Banu. And I'd like to add that yesterday the spokesperson of the Secretary General expressed the deep concern of the United Nations about the plight of civilians following the intensification of hostilities in the eastern Donbas region and the Kherson, Kharkivska and Dnipropetrovska Oblast. Sorry for my pronunciation. We continue to call on all parties to the conflict to enable the safe delivery of assistance and facilitate the safe passage of civilians evacuating areas where hostilities are increasing, in line with the discussions held by the Undersecretary General Martin Griffiths during his visit to Moscow and Kyiv. And also just to inform you that the UN is also gradually returning to the capital, to Kyiv, starting with the presence of senior officials. We will provide more details on this when the security consideration will permit it. And I'll open the floor to question now, and I'll start from the room. Christian. Banu, I'll introduce you. Christian Ulrich, who is the correspondent at the UN Geneva for DPA, the German press agency. Christian.
Banu, hello. Thank you for the briefing. Alessandra just introduced me. My question is on what you said, you are delivering to the east. Does that mean you are delivering to the government-controlled parts of the east, or also to the Russian-recognized republics? Same question would be in the other regions. Are you actually in the active fighting zones, or where do you actually deliver? Thank you.
Banu.
Of course, yes. Thank you for that question. So we have delivered to Luhansk and Donetsk, and we operate across the south and the east and the north, and we've been able to get supplies into those areas. We have not been able to get into Mariupol like many others, and then we continue to sort of call for safe passage to Mariupol, where we believe there is a huge need for health services. I hope that answers your question.
Yes, she's nodding. Thank you. So I'll go now to Emma Farge, our correspondent from Reuters. Emma?
Yeah, I was hoping you could spell out a little bit more what you're bracing for in the East. Obviously, the expectation is there's going to be a major offensive. Are you expecting mass civilian casualties? Is it going to get worse? Is that what you're preparing for?
Banu?
Thank you, Emma. You know, it's hard to predict what's going to happen, and that's not what we do. But we do certainly prepare for all eventualities. The situation is already really bad and challenging. There are hospitals without power. There's a lack of medical supplies, and there is a lack of medicines to treat chronic diseases right across the country. Should the situation escalate further, the health situation is only going to get worse, and that's why we're bringing in all these supplies. But we also need the safe passage in order to support the health system, because we're worried that besides the civilian casualties that might happen, there could be many more deaths resulting from lack of access to decent health care.
Thank you, and that gives me the opportunity to inform the journalists that the High Commissioner for Human Rights has recorded 4,335 civilian casualties across Ukraine since the 24th of February, including at least 1,842 people who have been killed. we think that the actual civilian death toll is much higher, as these figures do not include people killed in areas experiencing intense fighting. Peter Kenny.
Yeah, thanks for taking my question. I was just wondering, you said you're trying to get into Mariupol. The ICRC has been trying desperately to get into Mariupol. What do you think you have a better chance of getting in there than the ICRC? It seems that you're getting into other Russian-controlled areas. Does that mean that you're being blocked from entry into Mariupol? Thank you.
Banu.
Thank you, Peter. Look, the question is one of safety and security, and not just of the people that we potentially send into Mariupol, but also of the vital and life-saving supplies that have to get in. We are guided by the UNDSS and the security assessments that the UN carries out as part of the UN family, and we take action based on those assessments. So we are awaiting for a situation where we can go in and where we can ensure the safety of both personnel and supplies.
John Zarucostes, France 24.
Yes, good morning. Coming back to the attacks on health, do you have for us some more details on how many facilities or health units have been attacked in government-controlled areas and in non-government controlled areas in the East, just to give us a perspective, given you're operating across the front lines? Thanks very much.
Thank you, John. So as I mentioned, as of yesterday, 108 incidents of attacks, but we cannot specify, the location or identify affected health facilities, and that includes telling you, the number of facilities that either were attacked in NGCAs, so non-government controlled areas, and in the rest of Ukraine, and this is quite simply for reasons of security. We need to protect the confidentiality of sources and to prevent any further harm to survivors of an attack, as well as the affected population.
Thank you. Jamie Keaton from Associated Press.
Hi, good morning. Thank you. Thank you, and nice to see you, Banu. Could you tell us a little bit more, following up on Christiana's question? Can you hear me?
Yeah, sorry, there was just an air raid siren going off, but it's fine.
Following up on Christiana's question, you say that you're reaching Donetsk and Luhansk. How are you doing that? Are you going from Russia? Or are you going through Ukraine to get to those places?
Thank you, Jamie, and good to see you too. Unfortunately, that's an operational security sort of question, and I can't divulge how we move supplies in and out of certain areas, as you can understand, for operational security. So.
Indeed, thank you very much. Is there any other question to Banu or the other colleagues who are ready to answer you on Ukraine? Christian has a follow-up.
Yes, this is not for you. This is a question on human rights. Can you update us on your plans or your operations? This is to the spokesman for human rights, if they are here.
No, that's unfortunately, Christian, no, they are not here. They couldn't come. Liz is alone at this moment, so she really has some problems. But last week I have sent her your questions and she has answered immediately. So contact her, or I can do it for you. But she is not on the line, I'm afraid. Any other question for Banu or for the other colleagues? I don't see any. So thank you very much. Oh, Isabel Sacco from EFE.
Good morning. Thank you. It's just a clarification. When Banu says that they are able to work across Lugansk and Donetsk, is he talking about non-government control, areas that are not controlled by the government, because the province of Lugansk and the province of Donetsk, they have territories that are under the control of the government and others that are not under the control of the government. So you are talking about both cases. Are you in both cases working there? Thank you.
Go ahead, Ban. You need to unmute yourself, sorry. We are unmuting you, but you have to do the same thing. Try again. It should work now. I'm looking at my colleague. Now you're on. Thank you.
Great. So sorry, Isabel, I'll be very brief. I think it's the same answer to Jamie. We can't talk about whether we're working in sort of the Russian-controlled areas or the Ukrainian parts of Luhansk and Donetsk. And hopefully over the coming weeks and days and weeks, as the situation changes, we might be able to speak about that in more detail. But at the moment, all we can say is that we have been able to send supplies to those oblasts, but we keep calling for further access to reach some of the hardest to reach areas.
Indeed. Emma, you have a follow-up too.
Yeah, if I may, I know that the MSF has set up a system of like train evacuations from the east to the west. I was wondering if you're managing to set up anything like that, or any sort of air evac, or how well established is your setup for actually getting people to more functional health systems, either in Western Ukraine or other countries? Just tell me what stage you're at with that, please.
So MSF is doing an excellent job, and we certainly work with MSF and other partners to support, but we haven't got any sort of evacuation plan like the train sort of evacuation. As I mentioned in my sort of intervention, that we are setting up a medical evacuation from Western Ukraine or from other parts of Ukraine through partners. They will move patients to Western Ukraine, and we will then assist moving them into Poland for those kinds of medical evacuations. But our health cluster and is talking to partners all the time. We're working with over 100 national and international partners in Ukraine, many of whom do work with the sort of medevacs and evacuations. So we do support those programs. At the moment, for now, it's just the evacuation into Poland, but I believe we will be setting more up over the coming weeks.
Thank you very, very much, Banu Bhatnagar, the spokesperson in media relations of the WHO from Ukraine, on Zoom from Lviv. I would like to really thank you and wish you all the best for your work there. And move now. Okay, sorry, there is a question from Robin. Robin, very quickly, I'm sorry, we need to move to the next subject. Robin Miller is from AFP.
Yeah, okay, very quickly then, just if you could tell us a little bit about the health conditions of refugees who are leaving Ukraine. Have they got worse over time? Are people presenting with worse conditions now than they were before? Thank you.
I don't know if, Banu, you want to answer this, or we also have Matt Salmarsh on the line from the Refugee Agency.
I'd be happy for Matt to step in if he wants to.
Matt, would you like to say something about that? The health conditions of the refugees?
I think what we've noticed over the course of the last weeks is, even though the numbers of people crossing the borders has diminished, declined significantly, those who have been crossing, we've noticed, have been perhaps in a more vulnerable state, have had lesser means, and have also had less of a plan as to where they might go. In terms of the health side, I don't think I have anything specific to add on that, other than to say that obviously, we're there in Poland and the other countries with our partners like WHO to provide the assistance that's needed once they cross.
Thank you very much, Matt, and thanks again to Banu. And I like now to go to our colleagues from the World Food Programme and the FAO, and thank them because they regularly update us on the situation of food security in various countries. Today, we're going to touch upon 2 African countries, Somalia and South Sudan. Let's start with Somalia. We have on the line Lara Fossi, who's on Zoom from Mogadishu, and who's the Deputy Country Director of the World Food Programme in Somalia. We also have Etienne Peter Schmidt, who is the FAO representative in Somalia, also on Zoom from Mogadishu, and of course our own Thomson Piri and Adriano Timossi. I don't know who would like to start. Thomson, maybe you want to take the floor, and then we start with our colleagues in Mogadishu.
Yes, very good morning, bonjour à tous. Just a note to say we have issued already the briefing notes both for WFP and FAO. You should have received those at 10 or just after 10. And with that, let's go straight to Mogadishu, Alessandro. Thank you.
Thank you very much, but don't hesitate, Thomson and Adriano, to intervene if you wish. So I'll give the floor now to Lara Fossi for WFP. Good morning.
Good morning from Mogadishu, everybody. The situation in Somalia has been deteriorating for months as the extreme drought continues and bringing the country to the brink of humanitarian catastrophe. The latest data shows how rapidly things are getting worse, with 6 million people now facing acute food insecurity in the coming months. This is almost double the number at the start of the year. It's almost 40% of the population, and there is a real risk of famine in some areas if the current rainy season fails. And at this stage, the rains have failed to materialize. Families are struggling to cope with the impacts of the drought alone, and the drought combined with the record high food and fuel prices, which has decreased people's purchasing power, is creating an absolutely catastrophic situation for millions. So we have to act now to avert a famine. And we have been warning of a situation such as this since last year, warning that scaled up humanitarian aid is desperately needed. And yet the gap between the growing hunger crisis in Somalia and the resources that we have available to address it is widening. And the unfortunate reality is that we are now having to make some very difficult decisions to prioritize assistance, and we're taking from the hungry to feed the starving. WFP had been working to scale up its emergency response to 2.5 million people in Somalia, which is a next to impossible feat, considering that our relief funding gap is about 150 million. And now, based on the latest food insecurity figures, we are going to fall even further behind those rapidly rising needs. We've already prioritized our very limited nutrition funding to treat malnutrition rather than to prevent it. And this, of course, will mean that more people are likely then to fall into needing treatment for acute malnutrition in the longer term. And the threat of famine may force people into other negative coping strategies, selling off their livestock and their other assets, and this is undermining their long-term resilience. We're already talking to Somalis who had graduated from receiving WFP food and nutrition relief. They are building their own livelihoods with our support, but now fearing that they are going to be forced back into dependence on humanitarian relief. And here on the ground in Somalia, we're seeing firsthand what this gap between hunger and funding really looks like. There are dozens of camps for the internally displaced people, which have grown exponentially in the last few months. Thousands of households are pouring into them from the areas hardest hit by the drought. They're desperately seeking assistance. And when you visit some of these camps, you can see the lines of the new arrivals coming in. And many of these people are women and children. And frankly, it's impossible to see them and not be shocked by the visible signs of destitution and life-threatening malnutrition. And yet WFP and the broader United Nations only has resources to help a fraction of these people. If we don't act now to avert this looming catastrophe, not only will lives be lost, but livelihoods will be ruined, leaving more Somalis vulnerable to recurrent crises like this drought in the future. And this year has been a year of unprecedented humanitarian needs and hunger globally, just listening to that briefing from the Ukraine earlier. But we do implore the world not to turn its back on Somalia or wait until it's too late. There are millions of families' lives at stake. Thank you.
Thank you very much. I see already hands up, but we will go first to your colleague of the FAO, also from Mogadishu, Mr. Etienne Peterschmidt. You have the floor, sir.
Thank you very much. I hope you can hear me well, and thank you for this opportunity to speak. Lara mentioned already some of these really dramatic figures. We're meeting here today as 6 million Somalis now face extreme and life-threatening hardships brought about by the extreme drought that is taking hold across Somalia. Lara mentioned it. This is almost a threefold increase from 3.4 million people in crisis and emergency at the beginning of the year. The IPC report released last week by FAO's Food Security and Nutrition Analysis Unit and FuseNet, together with UN and government partners, does paint a grim picture of the fast deteriorating food security and nutrition situation, and should serve as a very loud alarm for another potential famine event in the country. I want to remind you that almost 250,000 people died the last time famine was declared in Somalia, and with the current likelihood of poor rain, skyrocketing food prices, and huge funding shortfall, as was already mentioned also, it means a perfect storm is brewing for another catastrophic event in which millions of people are at risk of sliding into famine. This is why FAO, OCHA, UNICEF, and WFP have called for an urgent injection of funds in a joint statement that was released today, as mentioned earlier, outlining the grave concern we have for the situation and the need to scale up life-saving assistance. There are currently some 81,000 people who are already facing catastrophic conditions in some areas of the country. They are facing starvation, malnutrition, loss of their livestock, crops, and other assets, and eventually disease and death. This number could rise swiftly and exponentially if there isn't a significant change of tack from current circumstances in the coming weeks, as Somalia's food-producing regions enter their lean season, global price trends continue upwards, and humanitarian partners are unable to keep pace with the need. This is not a slowly unfolding crisis, and time is definitely not on our side. From my time visiting some of the most hard-hit regions, I've witnessed many rural families that have completely exhausted their resources. The preceding 3 bad seasons have taken their toll. People have sold off all their belongings and have no more capacity to access credit. Their food stocks are finished and there is not enough water. In the end, they have been left with nothing in a land that can no longer provide for them. Desperate families are currently splitting up for survival, and many Somalis are pouring into informal settlements and camps where they experience further hardships such as measles, watery diarrhea, inadequate assistance, and physical and psychosocial risks. More than half are not receiving any assistance on arrival due to lack of funds. FAO is assisting rural families to stay where they are by providing life-saving cash transfers to purchase essential commodities such as food, water, and medicine, as well as livelihood items. We're also working with the government and partners to conduct a nationwide emergency livestock treatment campaign, protecting animals weakened by drought from parasites and disease. Protecting and restoring self-reliance after the drought is only possible if we can keep rural households where they are. Every $1 spent to protect rural livelihoods in Somalia saves around $10 in food-related assistance. And more importantly, it helps families stay together, reducing displacement-related risk, and helps communities recover faster after crisis. We also support the coordination of the humanitarian response with food security information and analysis and water monitoring through our food security and nutrition analysis and through the Somalia Water and Land Information Management Program, respectively. But the reality is, what we're currently doing is nowhere near enough. The needs are growing, but the humanitarian response is not able to keep up. The Ukraine crisis saw a redirection of global attention and funding amidst other already competing crises. UN agencies and humanitarian organizations are doing their best to respond, but the humanitarian response plans for 2022 is so far severely underfunded, as Lara also mentioned earlier on. From where I sit today, from experience, I can tell you the worst is yet to come. We're all watching this tragedy unfold and our hands are tied. I'm gravely concerned about the worsening drought and the possibility of famine in the coming 3 months. With current funding shortfalls, bleak rainfall forecast, and rising food prices globally, we are calling for immediate funding to scale up humanitarian assistance across the hardest hit part of the country. I want to stress that it is not too late. Funding received today can still prevent the worst, but it has to come at scale and it has to come now. Thank you very much, and back to you.
Thank you very much, sir. And I open the floor to questions. I just want to remind the journalists, yesterday we have distributed the readout of the Secretary General's phone call with the President of the Federal Republic of Somalia, where the Secretary General expressed his solidarity with the country, not only in the face of increased Al-Shabaab attacks, but also the drought that the country is facing. You have the full readout in your mailboxes. So I'll start with the room. And Christian Ulrich has a question for you from DPA, the German news agency.
Good morning. Just checking two facts. When was the last famine declared in Somalia that you mentioned? And the 6 million are out of a total of how many inhabitants? And my real question is, do you see signs of donations being diverted to Ukraine? In other words, would you have expected to have more money at this point on your appeals than without the Ukraine crisis than you actually have now? Thank you.
Who would like to start answering? Lara or Etienne? Just raise your hand.
Ladies
Lara?
first, happy to complete,
Okay.
Lara.
Lara. You need to unmute yourself.
Yeah, it
That's
wasn't
right, you're
allowing
on.
me to. Okay, great. Etienne can correct me if I'm wrong, but 2011 was the last time that famine was officially declared. In 2016-17, we averted what could have been a very, very catastrophic situation with timely humanitarian response. On the question of the 6 million, we are using population figures of 15 million for that. And regarding the donations that you refer to, for sure, there are donations that we had anticipated coming in that haven't yet been confirmed. I think all nations very stretched at the moment with the different humanitarian crises that are ongoing. We have seen a decline in funding for Somalia. And as I said, from WFP's perspective, we're $150 million short to provide food assistance, and our collective United Nations humanitarian response plan is pitifully 4% funded for 2022. So, yeah.
Etienne, would you like to add something, or can I go to the next question?
Yeah, no, just to confirm, yeah, the exact population figure is 15.7 million. But yeah, I confirm that attention has been largely diverted towards Ukraine, and obviously also has impacts more broadly in terms of the cost of our operation here. I know it's not directly the question, but it's obviously worth mentioning, because that means that to provide the same caseload of to provide assistance to the same caseload of people today is much more expensive than it would have been, last year or for the previous droughts. Back to you.
Clear. Thank you. Jérémy Lange, Radio France Internationale.
Oui, bonjour. Two questions for Lara. I think the first one, can you say what does it mean exactly in terms of food assistance when you say that you're taking from the hungry to feed the starving? Technically, what does it mean on the ground? And the second question is a bit like the one that was asked earlier. I was thinking it's been 2 years almost, I think, since the World Food Programme was awarded the Nobel Prize. Yet you have this funding gap of 150 million for Somalia. I guess you have other funding gaps for Madagascar and Yemen and relating to Ukraine. Can you technically use the crisis in Ukraine to get, if it's overfunded, to get the money from Ukraine to use it for other programs, or is it technically, legally not possible to do it?
Lara?
Okay, so on the first question, what does it mean? I mean, prioritization means making very hard choices. There is enormous need there, and we are currently reaching about 2 million people with relief assistance. But the needs are huge, so we are having to prioritize. We're having to prioritize internally displaced populations that are newly moving. I mentioned that there are huge surges of population moving across the country in search of humanitarian assistance, and they are completely destitute and arriving in IDP camps with nothing at all. But then there are the communities that are already in, as Etienne said, IPC classification 3 and above, who would normally require some kind of an assistance, but we're unable to do that. We have to prioritize the most vulnerable households and communities within that. We are even having to, as I said, prioritize nutrition support for children and mothers, only being able to address treatment. We've had to completely suspend all of the prevention of malnutrition programs. We simply don't have the resources to be able to cover that. So it's really about having to target the most vulnerable, doing that based on evidence-based data, on this collective analysis. It is not static. The new IPC figures just came out last week, and there are rapid assessments that continually go on in areas of concern so that we can make those adjustments as necessary. But with, disappointing great swathes of the population and also local authorities and the government very concerned that we are not able to continue supporting some population groups that had that assistance before. And I would also just like to mention that in Somalia, there is a social safety net system that the government had started over the last couple of years, which has provided an important buffer, I think, for populations. But this still has limited coverage. On your question of diverting or redirecting resources, it really depends on how those resources come to WFP and the flexibility that we have for those. Donors provide those resources sometimes earmarked for specific operations and for specific activities. And so, at an organization level, they get allocated accordingly. And where there is flexibility, then the different crises are being prioritized. But yeah, it's more complicated than just being able to divert those resources in the way that you described.
I see Thompson would like to add something.
Yes, very quickly, just to say, I wish we were able to divert. I'm sitting in Lviv right now. We are not floating in money. There has been a lot of solidarity. There has been a lot of engagement and an amazing outpouring of engagement. But likes on social media does not necessarily translate into saving lives. We are short of funds even in Ukraine. WFP needs $590 million to be able to scale up assistance and reach 3 million people in the next 3 months.
Thank you very much, Thompson. Lisa has a question, just to tell you that there is an update from Claire from WTO in the chat. Maybe Claire, if you want to read it afterwards to record it. I'll go now to Lisa, for Lisa Schlein, Voice of America. She has a question.
Yes, good morning, thank you. I was wondering, do you think if you don't get the money that you need and the attention that is needed, that the situation in Somalia could be as bad, perhaps even worse than what happened in 2011, when, as you said earlier, 250,000 people, mainly about half of them children, died from this. Do you have, are deaths already occurring? Perhaps you have numbers on that, and also on the numbers of children that are malnourished. And if the children do not get what they need, will they die? I mean, I'm sorry, it's horrible to deal with all of these terrible statistics, but if you could elaborate on that. And then just lastly, you say you need $150 million. Thompson mentioned something like 550. I'm confused about that. How much money overall do you need? And if you get that money, will you be able to take care of the 6 million people rather than the 2 million? Thank you.
I think Thompson was referring to a general figure, but let me ask maybe Lara and then Etienne, both, if you want to answer Lisa's question.
Yeah, okay, I can start, and then Etienne, you can come in with the more technical response, please. But I mean, risk of famine, this is a heads up that this assessment is showing that we are already identifying 6 areas in Somalia that are at risk of famine, that are at risk of going down that route of 2011 if we don't act now. And you heard from what Etienne said, what is going to be able to stop this? If the rains come, that's the GU rainy season that is due now, but they have not come. If the prices for food and fuel don't increase dramatically, and if we can scale up humanitarian assistance, we can avert those very worst outcomes that you're talking about. But if we are, if all of these factors continue to deteriorate, we are raising that flag to say there is a very real risk of famine, specifically in those 6 areas, and that includes IDP settlements in 3 of the towns. On statistics, I don't have statistics on deaths. There are anecdotal reports, but certainly on the number of children. From the February data that we have, there are 1.4 million children who are affected by acute malnutrition. And of those, there are over 350,000, I'm actually just looking for the exact, 329,000, I beg your pardon, 500, who are severely acutely malnourished. We are currently updating some of this analysis, particularly on those nutrition statistics, because we believe that they are actually worse than those figures which came from those last assessments.
Etienne?
Yeah, thanks, Lara. That's very comprehensive. Just to add on the crop side, on the agriculture side, we know that not only have we had 3 and now 4 consecutive below average rainfall, but we also have had way below average yields, up from 50 to 70% from the last 10-year average. So that's obviously of concern. Likewise, livestock mortality is an issue. It's something that is difficult to monitor, but we know it's an issue and we know it's there. Excess mortality, as Lara mentioned, it is anecdotal. It is happening, but it's difficult for now to quantify. But from the data we have, it doesn't reach yet the threshold that would declare an IPC 5, famine. Let me leave it at that in the interest of time.
Thank you very much. And I'd like to give Claire the possibility of just saying what she put in the chat so that it can stay on the record. Claire, you have an update on the issue of the rain.
Sure. Yes, and just to complement what the colleagues in the field are saying, Somalia is obviously very, very, very badly impacted. It's not just Somalia. WMO, we work closely with, it's got an acronym called ICPAC, the Climate Prediction and Application Center. It's based in Nairobi. It's our regional climate center, and it obviously works very, very closely with WFP, with FAO. And our colleagues there gave a press conference yesterday underlining very much what you've heard just now. but broadening it to Eastern Africa. And I'm quoting now from the press release saying, Eastern Africa is facing the very real prospect that the rains will fail for a fourth consecutive season, placing Ethiopia, Kenya, and obviously, as we've just heard, Somalia into a drought of a length not experienced in the last 40 years. We issue seasonal climate outlooks ahead of each rainy season. And when the seasonal climate outlook was issued a month or so ago for this region, there was sort of mild optimism that the rains actually might be fairly decent for this season. But unfortunately, as we've seen and as the colleagues have just said, there was very little rain in March. It was too dry and it was too warm. So it's the combination obviously puts stress on, on crops, on livestock, on people. And it's not just this year, as everybody said, this is now the fourth consecutive season. It's not too late, obviously, we're still not entirely through the rainy season. We've still got another couple of months. There is, hope that the rains will come, but yeah, it's not good news.
Thank you very much. Yeah, dramatic situation. I don't see other questions from the journalists on Somalia. So thank you very much, Etienne and Lara, for briefing us on this very serious situation. And we stay on the issue of food, but we move to South Sudan, also with FAO. Adriano has brought us Meshach Malo, who's on Zoom from Juba, and who's the FAO representative in South Sudan, also to brief us on the food security in South Sudan. You have the floor. Adriano, you want to start, or we have
just to introduce Mr. Meshach Malo, speaking from FAO representation in South Sudan. If you allow me very briefly as well, as I just circulated, FAO has few updated information on the response to the conflict in Ukraine that is also available in our website. There are several policy briefs that we really encourage you to have a look as well. So I give you the floor to our colleague, Malo. Thank you very much, Alessandro.
Thank you so much, colleagues from Geneva, and it's amazing, and it's good to see that South Sudan just came after the briefing on Somalia. Just when you look at the similarity after my presentation, it will show clearly the impact of protracted crisis and how much we need to invest also in peace to divert this situation and avoid these competing factors. But in South Sudan, we released the IPC analysis on Saturday, the 9th of April in Juba. And the results show that 2/3 of the country will likely face hunger between May and July of this year. In terms of actual numbers, that means this is about 7.74 million people. This is the highest number ever recorded. Of the 7.74 million people, an estimated 87,000 people will face catastrophe. That is IPC phase 5. These are the level of acute food insecurity, which is normally characterized by extreme hunger in the face of very limited coping option. These are situations that has also been explained by my colleagues in Somalia that can only be remedied by urgent and sustained humanitarian assistance in order to save lives and to re-establish livelihood so that it can see them through the next harvest season. On the issue, because I had the issue of children being raised to my colleagues also, that in terms of nutrition situation, the malnutrition rates are also high. In South Sudan, 1.34 million children are malnourished severely, and over 600,000 pregnant and lactating women are malnourished this year from these results. The key drivers of insecurity have included climate shocks, mostly floods, the dry spells, and droughts, as has been explained by the colleague who just intervened to give the results of IGAD. However, in South Sudan, subnational and intercommunal conflicts also play a great factor. The economic crisis and the increase in food prices have also not spared this country. This has been compounded by the low crop production and livestock diseases that have continued to deplete the household coping strategies because of the protracted crisis that have shrunk the income opportunities available in the country. And that's why when I started, I stressed the issue, the need to look at peace, which is one of the most important dividends that will ensure that basic services for the population also contribute to lifting up the population from the dire economic situation. So moving forward, FAO, WFP, UNICEF, and other partners, we are still calling on the need to invest urgently to reach the most vulnerable population, particularly those in catastrophe IPC 5, strengthening our early warning system and early action, and designing interventions that are meant to address both the short-term and the long-term bases, particularly in resilience building, in order to prevent households from falling back in such anger situation. But just as has been explained exactly by our colleagues, my colleagues in Somalia, FAO, WFP, UNICEF, and all colleagues, as we call for this scale up, the funding remains really low at this particular moment. And this is really affecting our response to the population much in need. I will leave it at that and we'll be glad to respond to questions. Thank you very much.
Thank you very much, Mr. Malo. And I'll open the floor to questions. I see Lisa Schlein of Voice of America has a question for you. Lisa.
Yes, good morning. I missed it. Are you speaking from Juba?
Yes, he is.
Yeah, okay. And if you would send us your notes, that would be helpful. Now you talk about you need money. How much money do you actually need? And how much of the country is impacted by this lack of funding? I mean, it's a big country. And so there are some areas, I suppose, are they the areas where there is live conflict going on as opposed to other areas which are more peaceful? Where the main problems help. And if you could fill in a bit in terms of, no, you've done that. That is the children and the lactating women. Are they at risk of death if they don't get immediate help? Thank you.
Hello. When you look at that, first, Lisa, thanks so much for the question. If you've seen that 2/3 of the population, that's out of a population of about 12.6 million people, 7.74 are affected. So these are spread out and the entire country. We've given the map. I hope it will be circulated. And when you look at those populations, we can only talk about the greater Upper Nile and the Jonglei area that are affected in phase 5. But when you look from phase 3 and above, those are population facing dire situation. So it is almost spread out across the country, only leaving out some pockets within the equatorials. And that's the problem with protracted crises, that it ends up affecting almost the entire country. And the floods have played a major role because it's been for 3 successive years in which there's been flooding. So areas that have been tremendously affected throughout. When we look at the funding, the gap, just for instance, for FAO alone, with a funding need for emergency and resilience of about $90 million, So far, we've got just a funding of about 25 million. So the gap is wide. Same to WFP. The same situation they are facing in Somalia. The gap has continued to increase while the number of in need, particularly as you can see from these results that were given out, that number increases while the funding of WFP has been able to reduce, actually not even increase. So the funding situation really remains dire. As was mentioned by Etienne, my colleague, we will not have immediate figures to give, but definitely the other competing demands around the globe from the same funders is one of the areas in which we think is affecting the area. Thank you.
Lisa, you have a follow-up?
Yes, I do. How are people coping? How are they surviving? I mean, apparently they're surviving on starvation diets of one kind or another, but quite seriously, how are they managing to survive? And what is the government doing in order to try to help its people? Thank you.
Yeah, in terms of survival, luckily for South Sudan, to some small extent, is that when you look at two major resources that are there, one is the livestock resource. The livestock population is about 36 million, but as you've seen over the years, with drought coming in, livestock get affected. And secondly is fishery resources. It's a country that has got at least some substantial fishery resources in some areas. And that's why we are also putting a lot of concentration on livelihood support. And that's why, for instance, FAO, we support them a lot in ensuring that the livestock health is okay so that they don't die out of livestock diseases. And secondly is that we distribute as part of the package the fisheries aspect so that they can be able to fish, particularly those along the Nile. So and that's why there is a lot of emphasis, if we see that we say humanitarian and livelihood support. That consists a very, very important part of livelihood support to enable them to be able to obtain this livelihood. But we are very, very concerned that these livelihood options can end up dwindling when people don't particularly involved in agriculture, or if there is a drought, or if there are diseases. Those then limit the livelihood options.
Thank you very much, Mr. Malo. And for Lisa's information, Adriano has just sent out the notes of what Mr. Malo just said. I don't see other questions for you, sir, but also note that we have quite a few information in the chat, including the IPC reports, links for Somalia and for Sudan in the chat, and also the numbers that Thompson has mentioned for the funding requests for WFP for Ukraine. So have a look at the chat for this further information. So we have a last speaker now. Thank you very much, Mr. Malo. I'll go now to our last speaker, who is Christian Lindmeier for WFP. Christian, you have two announcements.
Exactly, and good day to everyone. Yeah, two quick ones. Tomorrow should see another press briefing by the DG on COVID-19, the crisis in Ukraine, and other health emergencies. I note that there is apparently an SG briefing also at noon New York time. I guess Alessandra will say more to this. We should have ours at 3 o'clock local time here, so that should correspond well, but the advisory will go out this afternoon. Secondly, as you know, the 11th meeting of the COVID-19 IHR Emergency Committee was yesterday, and of course we're all waiting for their final deliberations on the report. We don't expect it really today, just so you know, but soon to come out. It's up to the committee to get that done. So, but I wouldn't count on it for today, but it will soon come. Over.
Thank you, Christian. Any question to WHO? Peter.
Yeah, Christian, might it be possible to get the notes from Banu from Ukraine?
He actually sent what he had prepared on. He had sent it already. It's with Alessandra's team already. Thanks.
Okay, well, we look forward to receiving it. Thank you.
Yeah, we'll put it in the summary. But if Christian wants to send it to you all, just please go ahead. Otherwise, you'll have it in a short while with the summary. I don't see other questions for you, Christian. Just a few announcements on my side. Yeah, first of all, and maybe the most important one, don't come on Friday. Friday is a holiday at the UN office here in Geneva and in New York, in fact, in the Secretariat. So we won't have a press briefing on the 15th. Sorry, Christian, before you go, I see Peter has a hands up. I think it's for you.
Yeah, Christian, could you possibly send those notes to us directly then, because we might have to wait a bit of time for the summary.
I got the note. I got the hint. Yes, we'll send it in a moment.
Thank you. Thanks so much, Christian.
Thank you. And Emma, is that for Christian too?
Yeah, for Christian, could I just might you have any information on the speakers for who were giving their interventions today on the pandemic treaty? Are there any kind of major players? And then on the notes from Ukraine earlier, I wanted to clarify one thing. Is this the first time the WHO is setting up field hospitals in the Ukraine setting? Is this like a new development?
Christian, I think you have also to unmute yourself on your side. Now you're on.
Yes, now I'm on. So on the field hospitals, as you remember, we have been talking about this quite a while, and already had our head of the logistics talk about it weeks ago. I remember how he was actually going to Lviv in order to set up or look into opportunities and options how to set up the field hospitals and the emergency medical teams to be prepared. That's always a logistical issue, but of course also a safety and security issue. The same discussion is in the neighboring countries for helping to receive refugees. So that has been ongoing. It's not a new discussion. On what was the other part? Oh, on the pandemic treaty discussions today. No, I don't have them. But if you want to contact Fadela, she might be able to provide anything further on that. She would be the focal point on the pandemic treaty deliberations today.
Thank you very much, Christian. No other questions. So I repeat my first announcement, which was that Friday we won't have a briefing. And as it is an official holiday at the Palais des Nations, and also just to be reminded that the same applies to Monday. So Friday and Monday are official holidays here, and the offices will be closed. Today, the UN Deputy Secretary General Amina Mohammed will launch the 2022 Financing for Sustainable Development report. This is going to happen at a press conference, which will be available on web TV, and it's 11:30 New York time, that is 5:30 p.m. Geneva. The report is under embargo until that time. If there is anybody who is interested in having the report under embargo, just let us know. This year's report will show that the unequal ability to respond to the COVID-19 pandemic has had a devastating effect on the economies and progress of developing countries. The report examines how unfavorable financing terms hinder recovery in developing countries and sets out concrete recommendations to bridge the financing divide. I like also to take this opportunity to remind you that the annual ECOSOC Forum on Financing for Development will kick off on the 25th of April and will last until the 28th of April. Over these 4 days, the event will bring together heads of states and governments and other high-level participants from governments and international organizations, as well as civil society, to review progress on the Addis Ababa Action Agenda, as you know, the roadmap for financing the Sustainable Development Goals, and the activities will be available also on web TV. Today at 4 p.m., There is a press conference by the Committee on Enforced Disappearances to present findings on Greece, Niger, and Mexico. And that's going to be at 4 p.m. and it's a hybrid press conference. And just to remind you that the Committee on the Elimination of Racial Discrimination will begin tomorrow afternoon, the consideration of the report of Cameroon, and the other countries to be reviewed under these sessions are Luxembourg, Estonia, and Kazakhstan. I think I've told you everything I had. Is there any question, any further question? I don't see any, so I wish you a very good long weekend. And we'll see each other again on Tuesday, 19th of April. Thank you very much.
Советский Союз находился с технологической точки зрения в полной изоляции. Санкции были тотальны. Тем не менее, Советский Союз первым запустил искусственный спутник Земли, первый космонавт наш, первый полет космической станции, по-моему, на Луну тоже наш, первый выход в космос, первая женщина-космонавт, дай бог ей здоровья, Терешкова, тоже наша. Мы все сделали в условиях полной изоляции технологической. Добились таких грандиозных успехов. Но неужели сегодняшняя Россия с продвинутыми технологиями не сможет дальше развивать нашу космическую программу, которую мы с вами обозначили как этап до 2030 года. Конечно, будем это делать. Более того, как ни странно, это вроде бы разные сферы совсем. Я тоже много раз об этом говорил, когда в 2014 году ввели первые санкции. У нас, как некоторые отрасли, шагнули вперед, скажем, в области сельского хозяйства. Сельское хозяйство стало высокотехнологичной отраслью производства. У нас мы даже объем экспорта превысил объем продажи вооружений, причем значительно, на 10 миллиардов долларов. И это, да, сегодняшнее состояние мировой науки, технологии, конечно, все взаимосвязано, а мы не собираемся изолироваться. А жестко изолировать в современном мире вообще невозможно никого, а уж такую огромную страну, как Россия, точно невозможно. Поэтому мы будем работать с теми нашими партнерами, которые хотят взаимодействовать. Будем работать и по ближнему, и по дальнему космосу. И нашу программу, лунную программу будем осуществлять. Ну, вот вы знаете, да, на третий квартал у нас станция Луна-25 должна быть реализована. Да? В третьем квартале успеем.
Должны. Пусковой окно закрывается в третьем квартале.
Значит, и дальше будем работать. Даже сами планы развития космодрома Восточный, они у нас до 1935 года. И технологии будем дальше развивать. Будем поднимать свои собственные компетенции. То, что мы раньше могли свободно покупать за нефть и доллары и за газ, понимаете, эти деньги все равно в стране остаются. Мы используем их для развития собственных компетенций. Только на пользу пойдет.
Спасибо. Вопрос. Дирекция космодрома Восточный, только Владимир Иванович. Владимир Владимирович, когда следует ожидать строителей из Беларуси на космодроме Восточный?
Александр Григорьевич.
Мы ждем вас.
За нами не заржавеет.
Спасибо.
Знаете, вот Владимир Ильич рассказывает, то есть вы говорите санкции, а я Дмитрию говорю, знаете, вот тут ощущение, санкций нет. Все свое, все делаете вы своими руками. Чего мы тут паримся из этих санкций? Что мы дома не построим? Устроим. Все сделаем. Время надо немножко. Поэтому для этого президент пригласил меня, чтобы я посмотрел глазами своими.
Все понятно.
На объем, на масштаб. У белорусских строителей хорошая очень репутация высокая. Это все будем делать. Но это не единственное, как я уже сказал, область нашего сотрудничества по космосу. У них очень хорошие предприятия. Причем наши разработки, финальное производство будет у них. Да, очень хорошие предприятия. Советских времен осталось. Александр Григорьевич не делал ему свалиться на бок, поддерживал. Будем использовать, активнее работать дальше. Это вот совершенно конкретные вещи. Будем делать высокотехнологичный аппарат. И работать здесь строители будут, и сотрудничество в космосе будем заниматься.
Спасибо.
Да? Вам спасибо.
Владимир Владимирович, в конце прогресса, Александр Александрович. Скажите, вот с каждым годом все больше и больше